If we as physicians order a test, we should be able to answer a few questions before we order the test. One is, what is this testing for? How will this change the patient's treatment? Can I interpret this test? What harm, if any, could come from this test? If there's a false positive, if there's a false negative, I need to know the general sensitivity and specificity. If I can't interpret the test and this test isn't going to change the way I treat this patient, there's no reason for me to order the test. Let's say, for example, someone comes in with new onset low back pain. Should I order an x-ray? Probably not. And here's why. Because the treatment probably won't change, because an x-ray probably won't show anything critical. And the answer for this low back pain will probably be exercise, stretch, strengthen the core, etc. These are low-risk things that patients could potentially try with little to no harm. They may get better. So why would I expose them to unnecessary radiation if I don't have to? The same thing could be said for the heart. If I have a healthy 22-year-old that's getting an elective surgery, why would I get a cardiac stress test on them? Just to make sure their heart's strong enough? I don't need that. Can they exercise? Can they run a mile? Then I know their heart is plenty strong enough for surgery. Because the tests we run, they're not all harm-free. A false positive could lead to someone getting a biopsy that wasn't needed, being harmed in a way that we didn't want them to be harmed in. It's not benign. It also wastes resources and it wastes the patient's time and money.